presentation by John and Bradley.
All right, good afternoon, Commissioners. Thanks for having me. I want to start off here and just talk about a couple of updates for you that we need your feedback on and see which direction you'd like us to head. So we're going to start off here talking about our third-party administrator, third-party administration services. So what a third-party administrator does, they handle our incident claims. So this could be for workers' compensation, this could be for auto liability claims, or general liability property claims as well. Currently, we've been using compensation claim solutions. The earliest documentation that I could find of our services with them is back from 2007. They are a company that's located in Concord as well. Right now, we do have 20 open workers' compensation claims, 16 open auto liability claims, and 9 general liability or property claims. So that's 45 claims total. We're hoping to have that number reduced by about 2 for the future when we hope to make some transitions. So just want you to keep that number in mind, 43 claims. So some ideas for changes have come about. We've had these ideas on the scope since about 2021. And these ideas have came from conferences, from talks with other local governments, from employees, as well as management. So some ideas for improvement. We're just looking for ways to better our service, our reporting measures to insurance, and risk mitigation and cost savings. So those are some things that we've investigated over the years. We've looked at other third-party administrators since 2021, and these are listed on the screen here. We first of all looked at compensation claim solutions, if there's anything that we've been able to edit with their services. We've also looked at specialized contractor administrators, SCA, PMA Management Corporation, Gallagher Bassett, Curvell, Brentwood Services, and Sedgwick, who is hosted through the North Carolina Association of County Commissioners. It's important to note out of this list has been provided by insurance, our Prima group, as well as other local governments' recommendations. It's important to note for NCACC that Sedgwick is hosted through them, but to be a member of NCACC, you have to bundle your insurance with your third-party administrators. There are some difficulties with that, specifically for us, because some types of insurance that we host are not able to be provided through NCACC. So through our analysis, the best option that we found for Cabarrus County and the potential for a move is SCA. And this is because they're very similar in relation to compensation claims and the positive attributes that we've been able to receive from the compensation claims services so far. Primarily our customer service. That's being able for me to call them up on their cell phones, reach them immediately, get immediate responses, and have dedicated claim administrators. So that is one thing that varies through a lot of these companies. Many of them you might call a 1-800 number and sit there on hold, wait to talk to somebody. For SCA, you have dedicated claim administrators. So I will have individuals that I can contact directly and say, hey, you're handling this claim, let's talk it through. That greatly improves service and also lets them know our county operations in greater detail. So that is one very positive attribute. They're also very prompt. So out of my requests that I've sent out, to market, emails, phone calls, they respond immediately. I've given them deadlines. They've far exceeded those deadlines and provided information immediately. They're also the most utilized and recommended throughout other counties that are similar in our size and are comparable to us. So they're similar in cost to compensation claims, and one important attribute for them as well is that they have also managed the transition of claim data from compensation claims, which makes the process a lot smoother. They have to do special programming to be able to import that data. That takes time, resources, and extra money. They've already got this code written, so the implementation and importing data is very smooth for them. PMA was the other strong contender for us. They seem to be better with reporting features and risk mitigation. They seem to be more designed for larger organizations, but they don't have the customer service that SCA can provide. Some additional values here, and this was a slide that might not be in your printouts. This was added a little bit later. But some additional values from SCA are the reviews that we got. Even one of those local governments reported that they are moving back to SCA from PMA. So they made the transition to PMA, which was our other contender. They didn't like the service, and so they're wanting to move back to SCA. So Gaston County, Catawba County, and the city of Lexington have all been with SCA for multiple years and have great feedback and positive reviews. We also have the benefit of their software. Their software is much more advanced than the software that we are currently using, and it allows us the potential to develop OSHA 300 logs. Many of you probably don't know what OSHA 300 logs are or have seen them, but it's very detailed logs of worker injuries, time out of work, time of restricted duty, and the nature of the injury. And this is required to be generated for OSHA reporting and the Department of Labor. So this allows us to automatically generate that log. I'm not saying that we should do it, but it's a great way to check our data that we are entering manually right now. So right now we manually enter this data into the log. We have to go through each year and make sure that those numbers are accurate. This is a great way to check ourselves. Another benefit is primarily on the insurance front, in that this company can provide much better reporting, which will potentially be able to lead to cost savings through the insurance that we are able to receive. So whenever we go out to market each year to look at insurance options, we have to take this data to the market. Having better reports of that data is going to help us out in those cost savings. So looking at the pricing here, and this might be a little small on the screen, but just want to show you the pricing of what we are currently using versus the switch. So right now, we are using compensation claims, and they have annual costs for administration of the claims. So for the workers' compensation, there's an annual cost of $34,250. For the liability and property claims, there's an administration fee of $24,000. So that's about $54,000 just for the administration. There are fees as well associated with each claim and managing those that go back into the claims. So one advantage of compensation claims is that 100% of our savings through using their providers or for medical prescription cost savings go back to Cabarrus County. That's a negative to many of the other companies that we looked at. The cost savings for switching to SCA are relatively comparable to compensation claim solutions. There's annual minimums for workers' compensation claims as well as general liability and property claims. So the annual administration fee for both is $2,000 for each, which is less than compensation claim solutions, but we do have to have minimum claim expenditures per year of $20,000 for workers' compensation claims and $30,000 for general liability claims. So it's not much different than what we are seeing now. There are charges for the takeover and transition, and that's part of the negative here, but this is going to be experienced no matter who we switch to. And there are some differences in the cost savings, such as medical bill review and prescription coverages. SCA would get a percentage of that cost savings, not 100% would go back to the county, but this is a greater incentive to SCA to go out and seek those cost savings because they are making a profit off of that. For transferring from compensation claims, our contract does require to give a 90-day notice. It's not agreed upon yet, but to obtain the data from them or directly from the vendor that they use to host that data, it is estimated to be about a $10,000 cost to extract all that data, including, every bit of medical notes, everything associated with a claim file, which is a lot of data. So that's the information of the cost. We also need to talk about our legal fees. So third-party administrators contract out legal services for claim administration. That could be for workers' compensation or liability claims. This change is going to happen no matter if we stay with Compensation Claim Solutions or if we switch to another vendor. I have already reached out to our current legal group that we've worked with for years that has done great work for us, McAngus, Goodluck, and Curry. They are the legal services that is utilized by compensation claims, and we can utilize them with SCA as well. The proposed increase in fees is posted on the slide here. It's a very minimal increase, and this is still well below the market rate for these types of attorneys. You can see to the right the average last 4-year expenses for each type of attorney. We have 2 different attorneys that we use, one for our liability and property claims and the other for our workers' compensation claims. This is the average expenses over the last 4 years, broken down by year. So we're looking at under $45,000 a year per attorney for legal expenses. I will say what we cannot accurately post is how much money they are saving the county. Utilizing this attorney group is saving the county a lot of money. Just for workers' compensation claims alone, over or slightly less than half of the predicted mediation settlements that we have come in well under the prediction value that we would settle that claim at. We are finding huge cost savings from these attorneys. So it's hard to incorporate the cost versus the expenses here, but I will say they are saving us more money than they are costing us. And what we would look for as well is we would look to take action to sign a contract with the legal services outside of our claim administrator. So our proposed plan of action is to work out agreements with SCA and compensation claims to start the transition process before April 1st, which is our deadline to giving a 90-day notice. We do have the ability, as I said before, to extract the data from censure risk instead of compensation claims per the contract. And they are estimating, I've already reached out to them to see what the transition timeline is. They are estimating that it would take about 2 weeks to pull the data together. So my idea would be to do an initial pull to give that data to SCA and then do a final data pull once we give compensation claims our 90 days notice for transition. And that way the transition would be a little bit smoother and SCA could be prepared to take over those claims. SCA would take over the current claims as quick as possible whenever we make that announcement and the first transition has been conducted. SCA would then take over our new claims immediately, and we would have to work through the transition process to transfer over our open claims, which is about 43 to 45 claims at this time, to SCA. There is a charge per claim for takeovers, which is $400 per claim that is open. Closed claims do not incur a cost for taking those over. We would also have to provide updates to our department heads, supervisors, our employees, as well as our emergency action plan and policies. So we'd work with ITS to get those changes made as well. We do not require a close or a suspension of the rules and a vote to do this. This can be done at the county manager's or deputy county manager's direction. We just need guidance from the board if they would want us to do this. We do have the funding available between our claim administration account and our claim fees accounts to be able to cover the cost of this transition. We're estimating that the cost of the transition would be about $35,000. So we do have the money available from those accounts, but we would probably need to request a budget amendment to be able to move some of that money to the proper accounts. So want to stop there. If you have any questions, happy to answer those, but after that we can move on to our next topic.
Any questions, comments? Okay. And I'm fine with making the change. I think we,
Okay.
I know we've had some discussions about it, and so I think it'd be great to go ahead and do that.
Okay, awesome. Thank you very much. Now we're going to move on to our second point, if this will work. Talking about the Americans with Disabilities Act and transition plans. So in 1991, that's when the ADA requirements started coming into effect, which required us by 1993 to have a transition plan. And we do fall into three types of ADA requirements, Title I, II, and III. So components of an ADA transition plan, it's very lengthy. It does require the need for a public survey, facility evaluations, modification requests, grievance procedures and policies, the establishment of an ADA coordinator, which I am the county ADA coordinator, as well as staff training. So some examples of transition plans that I was provided that are easily available online are for the city of Charlotte as well as the town of Chapel Hill. Those are readily available. The company that I've been working with to prepare this presentation is also currently working on Brunswick County's ADA transition plan, but there are multiple companies out there that can provide this service. This is a small slide, but it is an example of facility evaluations, and this is the most expensive and complex part of an ADA transition plan, because primarily you'll bring in either an architecture group or some other third-party group to look at your facilities and fully evaluate the ability to accommodate individuals with disabilities. So that could be sidewalks, that could be parking lots, that could be bathrooms, stairs, access to second levels of buildings. So those are the most complex and comprehensive parts of the ADA transition plan and take the most time and resources. The next part here is just an example from an ADA transition plan of website coding. So this is another part of the ADA that's a little bit newer, but you have to evaluate websites and their functionality for persons with disabilities. That could be speech, that could be those that are blind. Many different disabilities do have to be accommodated on our website. This is an example of a survey. This was a public survey that was provided to discuss what the public feels is needed in different facilities. What are they having difficulty accessing? What do they feel needs to be improved? Those surveys do have to be provided, and this is just an example of one of those. And then here is just another part of the transition plan, just open communication of the coordinators, what the policy is for the county, and that type of information, making it available to the employees as well as the public. So currently, this is some information that we have. We have been working on a transition plan for years. Again, the most comprehensive and complex part is doing the building and facility assessments. That includes assessments of the parks and assessments of our buildings and sidewalks. So currently, some of those assessments that we've been able to do with leftover money from our budgets is assessments at some of our parks, including Camp Spencer and Frank Lisk. We've also done assessments at a couple of our libraries, including Concord and Kannapolis, and Harrisburg Library, and we've done this Concord Senior Center. We've done a few assessments at the governmental center as well, and as you will be able to tell, that's what some of our newer bathroom facilities here have come from, are those building assessments. We do have some newer buildings that don't require those assessments because they are built up to the current codes for ADA. That includes our EMS headquarters, our Mount Pleasant Library and Active Living Center, our Afton Library and Active Living Center, our new Franklin Park office, mini golf, and barn. Those are all built to current codes. Our ITS and emergency equipment warehouse, our IAM operations center. Those are all newer buildings or buildings that we've bought and made the appropriate renovations on already to be compliant with code. We have currently utilized Precision, which is the company that I've been working with to create this proposal for our sidewalk assessments. We use Precision Safe Sidewalks for those, which is a division of Precision. For our camps, we have utilized Site Solutions to do those assessments, and for our buildings, we've utilized Beloba Architecture to do those. So currently, we have also been working on revising our grievance policy, making that more formal and available to staff as well as the public, revising our ADA policy, revising our accommodation forms, and those things take time. That takes time away from me, that takes time away from our county attorney, as well as county management who has to review those plans. Takes a lot of effort and resources to do that. Currently, we have been providing monthly training to some of our employees who interact the most with persons with disabilities through Disability Rights and Resources, and they're our local ADA advocate. And they provide that kind of training for us, for Charlotte, for many other local municipalities and businesses as well. Here's an example of our website. Todd and his team have done a great job of trying to make the website as ADA accessible as possible. They're utilizing this third-party service to run a scan of all of our web pages. So this is our compliance score so far in regards to ADA needs for all of our web pages. So I'm going to present a couple different proposal options. I'm not saying that we need to go with either one of these, but these are just the options that are out there. Obviously, if we were to move forward with the ADA transition plan, we would probably look at some other vendors as well to see if we can get any cost savings. But this is the most hands-off approach for the county, and this is a pricing option through, again, Precision Infrastructure. And this is an example of their costs. This is a piggyback contract to pricing that they established years ago for Loudoun, Virginia. Lots of other North Carolina local governments have piggybacked onto this pricing structure, and as long as Loudoun, Virginia is using this pricing, other local governments are able to utilize that same pricing model. The pricing for this includes utilizing and having access to an ADA coordinator to help us with developing our plan, facilitating that, answering any sort of questions, and providing a resource to us from a third party that has lots of experience dealing with ADA accommodations, assessments, needs, and facilitating plans. So that's one of the benefits of utilizing a third-party service is we're a little bit more hands-off, and they're creating all of that for us, assembling the data and information for the county. For facilities self-assessment, this includes all of our facilities minus a couple of the newer libraries. So this price, if we utilized some of our existing facility assessments, could even go down further. Our website, again, we are already assessing that internally. This is just a cost option to include a website assessment but this also only analyzes 11% of our web pages. So this is not a full assessment of our website. The total cost, they estimated to be $94,575. The cost without the website assessment would be $81,825. The website assessment, again, is optional. But again, some of these building and facility assessments could also be reduced as well. Precision is estimating that it would take 67 days of work to complete. That is 67 full days of work. So if you imagine if we were to do that ourselves, how much time that would take out of the county staff, that is significant. We also have very limited staff that could do a building inspection. That would be from our codes enforcement officers, which they do not have time to do this. They also do not have the programming and template structures to be able to create a very concise report that is readable by anybody with cost estimates for repairs. That's why third-party options are the best to conduct these surveys. The other option that was presented is from Disability Rights and Resources. They're a 501c3, and they provide lots of free services to us, including that monthly training so far. They did propose a schedule to help us out, but this is more of a hands-on approach for us, and this does not include facility assessments. This is only for the training part, as well as trying to help us compose an ADA transition plan, including editing some of our policies, procedures, and stuff like that. So the guidance would be $1,500 for the first year, and that's with monthly meetings to guide us throughout the process. They would also provide training and support to all of our staff for a $200 flat fee. But again, this is going to be limited training. And then staff training on top of that would be $400 per 90-minute training. And typically this occurs monthly for 2 to 4 months from other agencies and governments that they have worked with. So they are estimating about $25,000 total, which is a little bit more than utilizing a third party's ADA coordinator to develop that transition plan. Utilizing a third party's ADA coordinator is a little bit over $14,000. So utilizing this service is great, but they don't provide the community surveys either. So there's a lot of things that utilizing Disability Rights and Resources would provide benefit, but also more work for the county as well. So those were the two options that we looked at in regards to this proposal. The proposal back for precision infrastructure, this doesn't have to be done over 1 year either. Typically, ADA transition plans and facility assessments, because it does take so much time to complete, and especially for the county to start working on making some ideas for some of those renovations, takes a lot of time. So most local governments take between about 5 and 7 years to do this. So this cost could be spread over that sort of timeline as well. So, we would be looking at $20,000 or less per year to be able to facilitate this ADA transition plan. So I just want to open it up to you now if you have any questions, but we are mainly just looking to you for some guidance and seeing if we can move forward with looking at these options.
Any questions, comments? All right, thank you.
So thank you.
All right, next on our agenda is USI benefits presentation.
Thank you for giving us this opportunity to share information about the health insurance plan this afternoon. My name's Joanna Ray, and I'm the Health and Wellness Manager in the Human Resources Office. Each year during the retreat, our benefit broker presents current health insurance status, and this year we're with USI Insurance Services. We'll share the overview of plan improvements, the projections for FY26, and then also strategies to curb cost. Thank you.
Thank you. My name is Larry Reese. I work for USI. Thank you, Joanna. Thank you to the board for the chance to be here with you today. We've got a short PowerPoint presentation. I think everybody has a copy. Forgive me, I can't see quite that far, so from time to time you might find me looking down. But I'll walk you through the, let's go one more. We'll pause here for a second. Can everybody hear me okay? You're a self-funded plan sponsor, so essentially that's the opposite of being fully insured. So the way to think about that is you own your own claims, you pay your own claims, you pay, when risk management was talking, third-party administrator, you also have one. You have Cigna. Most of you guys are ID card carrying, so Cigna would be your TPA and your rental network. But just want to point out for the good of the group, you're a self-funded plan sponsor. So basically you pay a TPA fee, an administrative fee, you buy some reinsurance, and then you pay your own claims. Or Cigna pays those claims on your behalf, and then you wire them funds weekly to cover those claims. You have two medical plans. You have what's called an open access plan. Maybe everybody better knows that as a traditional PPO. They're basically the same thing. About 30% of your people are in that plan, and 70% of your people are in the other plan, the qualified high deductible plan. Actuarial values are a little different between those two, and you heard Joanna suggest last year we made some improvements to one of the plans to kind of bring it up alongside the other. Those two plans are pretty close together now, which is great. One plan was, based on the bullet points here, one point to note, one plan was less than the county group average. You'll see that on the next page or the following. Now it's not. Now it's kind of more close in line with other municipalities and other large employers with self-funded plans. And we think those were good moves for recruitment and retention. We'll kind of tag into agreeing with Joanna in that sense as well. We improved that plan, or you improved that plan from an actuarial value of about 71 to about 82. Conversationally, a 10% improvement to that plan. So more claims would be paid, similar to the other plan, making them more equitable, if you will. I think I already mentioned 70% of the employees are enrolled in the high deductible plan. No changes. Actually, every year, the federal government, the IRS, issues guidance on that plan design. That plan was diluted a little bit, but because you keep it right at the threshold. So when the IRS comes out with a change to the threshold, you're compelled to make that change to keep that plan legal. So is everybody else.
So the deductible increases every year or two.
Like $100 or so. But I mean, it's published. Everybody has to do the same thing. You did make that change to keep that plan compliant. Again, in both, if we go to the next page, it'll make the point. The last point there was both plans benchmark well. You don't have 6 plans. The orange bar is you. You really have 2 plans. So for those in the room who don't have copies, HDHP stands for High Deductible Health Plan, and you'll see 3 versions of that. And the only difference is who's wellness compliant and how wellness compliant are they. And then the other plan I just mentioned is the OAP. Let's call that a PPO plan, where you access Cigna's network of preferred providers, in which when you go in network, it's a much bigger discount. Those 2 plans, as I mentioned on the previous page, are very similar now. One has an actuarial value of 84 and one has an actuarial value of 82. That might not be helpful, but that's to say something like, if you're buying a basket of groceries in one store and you buy the same basket of groceries in another store, these being the 2 stores, the high deductible and the open access PPO, that basket of groceries in one store would be 84% paid for, and the consumer would pay 14% of the groceries. Same basket of groceries in the PPO store, 82% of those groceries would be paid for, and the consumer would pay 18% of those groceries. That's all this is trying to tell you. So we're trying to keep those plans reasonably close to one another. And then like salaries, you guys would want to know, well, how do our plans compare? And there's 4 other benchmarks to compare to. One is the peer average is the average of the other 3. So you are mildly favorable to that. Compared to other large county governments, you're a little less favorable, but right there. And then compared to employers, so no longer municipalities, no longer local government entities, all employers with 1,000 plus employees. And This comes out of an 80-page survey deck. I forgot to tell you this. We have about 10,000 clients that responded to the survey across the country. And so it's pretty realistic, pretty good comparative analysis database for you. And then Mid-South, so taking out, now it's small employers, large employers, but only in the United States and the Mid-South for the U.S. And as you see, those plans are a little less rich. So conversationally, the way I would have you look at this is your plans stack up pretty good. You are, I would not say that your benefit plans are your lead recruiting tool, but I would also say your benefit plans aren't the reason people are leaving, right? So you're kind of finding that sweet spot right in the middle is how I would characterize it for the good of the group. A little bit of a swing now to fiscal year 26 forecast. That forecast was 9.6% increase. Again, your self-funded plan sponsor. Your administrative fees to Cigna are zero. That's not on this page, but it's worthy of calling out. All of the forecasted increase to 1.66 million is a claim increase. A portion of that's for reinsurance, but reinsurance is, again, like homeowners and auto. That goes up whether you use it or not, like all of us as consumers. And that's the portion where a claim over $200,000 would no longer be the county's responsibility. The reinsurer would pay everything over $200,000 is a reimbursement or recovery back to the county. And we've estimated that increase. Right now, there's a placeholder for 15 to 20%. We market that every year. We go to 15 or 20 carriers. It's not on the ID card. It's not in the open enrollment guide. So we can canvas the market on that. There's no frictional change cost to a consumer. It's no big deal. So as long as it's A paper and they pay you back, well, we take the best price we can get for you there. But, well, oh, sorry,
Oh,
Linda.
no, I was just going to say, I think last year's increase was 8% to stop loss.
To stop loss.
Negotiated from 16%. Again, we go to 10 markets, so we put a conservative placeholder in there, and then we go to 10 markets and hope we can do better.
But most of it's claim cost, right? Which is core inflation. If core inflation is 3%, healthcare inflation is 7 to 7.5. Pharmacy's probably 10, and medical is probably 6, 5.5 to 6. And you blend those two together, and that's how you come up with about a 7.5% trend increase. So for every client we have across the country, when we're doing a forecast, one of the roles we would have for you is to predict what we think you need to budget next year in order to cover your claims. We kind of all call that core inflation. And in healthcare, we call it trend, and we're trending your claims at around 7.5%. So whatever you bought last year, that basket of groceries, that same basket of groceries next year is going up by 7%. And it's going to go up by 7% every year. And that's kind of an all-hands-on-deck number. I mean, that's not do nothing, just hope for the best. That's actually, there are a lot of things being applied to keep that trend at 7%. We'll talk about a few of those in a second. A little bit of our historical work to give context on the $1.6 million increase. A few years ago, and you'll be up for it again, I think next year. Do I have that right?
Yes?
So we go to all of the large carriers. You might know the term BUCA, B-U-C-A, Blue Cross, United, Cigna, Aetna. Those would be the big four. There are other players, but for a group of your size and because you're self-funded, single most important thing is how big's the network and what are the discounts. So we do a lot of what I call pre-qualifying work to make sure. When we did that last year, or excuse me, we did that back in 22 for a 3-year contract. Cigna was successful at retaining your business. They offered you $250,000 in savings, and in pharmacy terms, you picked up $2.3 million. Pharmacy's where all the action is these days with rebates, and we're all reading articles out there on what's going on in American pharmacy, especially with Medicare. So a lot of good things are happening for the county self-funded plan sponsor. You get those rebates. It helps offset your otherwise increased forecast. As noted here, you picked up another almost $740,000, $740,000. And why do United all get it in 1 year? Rebates are paid to the county to every client retrospectively after. So if I go in the pharmacy to get a drug today, it's a rebatable drug. I pay my copay. My employer pays for that drug that week through a weekly wire. When does my employer get the rebate money? 180 days later. So there's a lag and there's reconciliation that takes place. So that's why out of the 740, you're only seeing 434,000 credit in your forecast. You'll pick up the rest of that credit next year. So it's kind of always revolving. You get half of this year's and half of the year before, and that's how it works. I think I mentioned next year will be the year to bid Cigna, if that would be the will of the entity, if that's y'all's desire next year. That contract would expire, and we would go back and do a marketing to all the qualified players, so to speak. So that's a lot, pretty at a rapid pace. We'll transition now to maybe, hey, well, you said trends running around 7.5%. Tell us why our claims are up. And so we wanted to kind of give you guys a peek at that. Maybe hit the next
Oh, I'm sorry.
little guy there. Yeah, here we go. I'm going to hand it to my colleague Linda Klein to talk about a few things.
So we talked about trend at 7.5%. So what's driving the medical costs this year that we're predicting 7.5 to 9.5% increase for the new fiscal year 26? So primarily driven by large claimants. That kind of makes you normal compared to our other groups. Large claimants being over $75,000 per claimant. Your stop loss is at $200,000, but what we consider a large claimant is somebody maybe at $75,000 in claims. So those that are taking specialty medications that can be very expensive, delivered through infusion, inpatient, we're talking cancer, MSK, musculoskeletal, people having, back surgeries, hip replacements, knee replacements. So it's really large claimants that are driving the increase, but we see that with all of our groups, so that just kind of makes you normal. Your pharmacy claims account for about 29% of your overall claims. Industry norm today is between 25 and 30. So you're kind of on the higher end, but still in the normal range there, again, due to specialty medications for cancer, infusions, rheumatoid arthritis, MS, things of that nature. Again, MSK is now your number one spend for total plan spend by condition, followed by cancer and gastrointestinal. So we've had conversations with the county about, what are some programs that we can do to kind of address that, and we'll talk about that later in the deck. But I mean, that's essentially what's driving your claims cost. 45% of your members are identified with a chronic condition. Again, industry norm, unfortunately. We're talking about, diabetes, asthma, COPD, what am I forgetting?
Cardio, yeah.
Cardiovascular
disease.
So, these are people with chronic conditions that have to take a prescription every day to manage those conditions. Your clinic does a great job helping to manage those, and Cigna has programs to help you manage those and getting them enrolled in those programs. So even though we're talking here about what's driving your medical claims, your pharmacy claims costs, it's really no different than the other clients that we work with. Just kind of makes you normal.
Yeah, it does. I mean, great job, Linda. A couple of things that I would add, like, hey, you might be surprised to know, a group of your size, would you be surprised to know you guys probably buy about 30,000 scripts a year? So whether that's an antibiotic, penicillin, azithromycin, those are pretty common generic antibiotics. But there are a lot of maintenance meds, right? And if we have a chronic condition, we would hope that your employees and covered family members are taking a maintenance med. Many people are. But I just thought, hey, for you to have context, wow, really? 1,200 employees, maybe 2,000 covered members, and we're buying 30,000 scripts a year? Yep. And that just makes you normal. You'll probably have, and Linda mentioned high-cost claimants at 75,000. You cover 2,000 belly buttons, right? So employees, spouses, children. Out of 100 covered members, out of 2,000 covered members, probably 100 of them are spending $5, $6, $7 million. So that just makes you normal, right?
Yep.
But just to kind of get your mind around where it's coming from and how much is it and how do we and where do we spend it, I thought that context might be interesting and useful to you to
Yeah.
consume the information.
And sometimes when we see pharmacy claims higher, that's not a bad thing. And again, high blood pressure, cholesterol. If people are taking their medications,
That's good.
hopefully that's keeping them out of the hospital and reducing the medical claims costs. So we're not necessarily alarmed if somebody's pharmacy costs are higher than the
Right.
norm. That means they're being compliant and taking their medications for those chronic conditions.
And you want that. I mean, it's one of the things the clinics help and drive.
Yep.
So next
yep.
clicker guy. Oh, and I don't know if this is you or me, but these are just strategies for, so we've talked to staff about these strategies for the last couple of years, and we start down some of these roads, and you're doing some of it now. You embed as much as you can with your current providers, Cigna and Express Scripts, and also with the clinic. But we talked about musculoskeletal, MSK, basically knees, hips, shoulders, back, right? We're all getting older, and we live sedentary lifestyles. So you have a wellness program to get people moving, get people active, and then you can come behind it with some other programs. There's some really cool digital stuff to get people active, using smartphones and leveraging technology to get some people moving again. It's really neat. If you guys remember the old Wii machines, the Sony Wiis, and whether you were bowling or golfing or playing tennis, and you held this wand in your hand, and the camera saw what you were doing, and then so it used your motion on the screen. Believe it or not, there's physical therapy now that uses your phone and does the same thing. You wear a couple belts, but while you're wearing these belts, the phone picks up what you're doing, and so that's PT at home. It's cheaper, and maybe you're not buying hips and knees if you can get people to do it. So that's just one. I won't go one by one on those because I know we're trying to keep a pace. But there are some things that the county can do to start to try to bend that 7.5 trend. Can you get it all the way to 0? Probably not. But if you do some aggressive things, can you take 100 basis points, 200 basis points out of it and really help employees and lifestyles? Yes, you can. And you're on that journey now, and you're doing a pretty good job of it. But there's a couple other things that and these are the ones that we continue to talk about. And you're not going to do them all in 1 year, but you can pick them off one at a time when you have time and content to do it. What would you add to that?
No, just again, there's some other specialty pharmacy programs we're looking at. I mean, again, that's not going to have a huge impact on those high-cost specialty drugs. There's not a lot you can do there, but you can take advantage of manufacturer assistance where the manufacturers of these drugs provide coupons that benefit the member and the county. So those are things we're looking at to reduce specialty pharmacy costs, continuing to promote the on-site clinic, virtual care options. Cabarrus County employees take really good advantage of the clinic and virtual care, which helps reduce costs. I mean, getting care through the clinic and through virtual options reduces the cost versus when people are going out into the open market and seeing specialists and primary care doctors. And obviously, it's very convenient for the employees and encouraging them to get care and preventive care done ahead of time. So continue to promote that. Compassionate offboarding, I mean, essentially there, we're talking about when people might be, offered COBRA or have some Medicare options, just making sure they're educated. Would it make sense? Do they need to stay on the plan for COBRA? Or can they find something better in the marketplace that's better for them and takes the employee or their members off the plan? So different educational opportunities there. And we already mentioned looking at marketing the Cigna medical and pharmacy programs again for your next year's renewal. Oh, here, this arrow.
Yeah, so what's going right? A lot of things. So we would call these maybe key performance indicators, or, hey, Larry, besides our financial performance, which we're running a little hot compared to budget, and if the forecast is 9.5% and trend 7.5%, we're a little north of norm. So we get it, but hey, tell us a little bit about what else is going on besides the financial. Here'd be some things that would speak to the health of the group. So gaps in care compliance, 79% is really good. Linda talked a minute ago, if you have somebody on a chronic condition, so an asthmatic, are they compliant with their regimen? A diabetic, are they compliant with their regimen? Believe it or not, Cigna looks at that data and provides insight to USI and to the county over, hey, these patients have some gaps in care, let's get them in the clinic. We don't see names. It's all PHI, protected health information, but the right effort is brought to bear to help those consumers become compliant. And so that data is looked at. Because if we can get people compliant, then we don't have ER visits and we don't have long-term stays in the hospital. We have a 2-day stay, not a 2-week stay. Emergency room steerage. So are people using the emergency room for the right reasons? And so we look at emergency room visits, and they're able, based on coding, to tell us, was it a true emergency or was it an urgent care event that happened in an emergency room, and it could have been handled at virtual, primary, or at the clinic. And so you guys are doing great there. And look at your virtual visits. That's really good, 1,000 virtual visits. And then preventive care utilization. So that's the annual exam, right? You're getting a 53% compliance rate. That's pretty good. Norm would be a little bit below that, maybe like 50, 51.
Which is sad to say, that's doing good at 53%, but that's the industry average.
It is, yeah. Generic drug utilization, that's really off the chart good. Generic drug utilization, so if I just told you bought 30,000 scripts, how many of those 30,000 scripts were purchased generic? And by generic might be $20, and a brand's probably $400. So you want to get all the generics you can get, right? Well, why can't we buy 100% generic? Some prescriptions just can't be filled generic. All that's available is a brand. And typical, you talk to other clients, this number at 94 is usually like 87, 88. So for you guys to be that high, that's off the charts and really good. So there's where you're better than benchmark, and that's what you're doing right, which is applaudable and suggests all the great effort between HR, communications, the clinic, and all the efforts to help people stay well.
So from all the individuals that are insured, and we're talking employees and family members, there's 30,000 prescriptions.
Yeah, that's about right.
Yeah.
Okay, and now how many people are insured? Employees and family members, how many are on that?
2,000 belly buttons. You have 1,250, conversationally, this is not an exact number, but
Yeah, right,
conversationally,
just round about.
your W-2 employee base enrolled in the medical plan is 1,250 employees. How many of those employees choose to cover a spouse or a child? 50%. When they do, that rolls, so now belly buttons. I'm taking you from W-2s to belly buttons. 1,250 W-2 employees. How many of them choose to cover somebody besides themselves and their family household? That gets you to 2,000 belly buttons. Children and spouses included, okay?
So that's over 10 prescriptions, I mean.
There you go, national average
I
is
mean, well
12.
even
You're
more.
just doing that in your head. National average is 12.
Right, yeah, well, I mean, that 3,000, if 3,000 was, insured, that's 10. So if we're only doing 2,000, that many prescriptions.
That's about right.
Okay. I've just never heard of that, but clearly I haven't been exposed to that. I don't know. So,
Yeah.
okay.
Pretty normal, unfortunately.
She's looking at me.
Yeah. Yeah, a lot of people are on zero, and a lot of people are on 10 maintenance meds a month.
That's in a year, right? So
That's in a year.
That's in a year, so if I'm on a monthly medication that gets refilled,
That's 12.
that's 12.
Yes.
Sorry, thank you for that clarification.
Okay,
Thank
that
you.
gives me better
Extrapolation
clarification.
math, it's not that
Yeah,
we have-
that's right.
Okay.
That's right.
I was
Thank
thinking
you.
ongoing, yeah, I'm thinking,
I was like, wow, we are really ahead.
yeah, okay, all right. Okay.
Actually, you're normal.
Well, that makes it better. If it's
Okay, yeah.
12, yeah, one, okay.
Thank you.
Wish I weren't having to take everything I'm having to take.
Yeah, yeah.
I don't know, me too.
And dental. So this is a voluntary plan, meaning your employees pay for this. The county doesn't. It's just pay, you've given them convenience of a payroll deduction in a group plan with no underwriting and no pre-X. So I'll give.
Yep, yeah, so we're projecting an increase of 26% due to claims utilization. That sounds like a lot. I'll try to put that in perspective, but this is kind of consistent with our other clients, like kind of in a post-COVID world. We've seen with all of the other employers that we work with that offer group dental, utilization has gone up. People have been putting off care, and now they're getting crowns and root canals and things of that nature, so.
And dentists can't keep hygienists. The
so-
marketplace changed.
Yeah, so it was hard to get into a dentist for a while in the post-COVID world. So, I mean, basically a 20% increase, so your employees, for single coverage now, they pay like $31 a month, so that increase would be between like a $7 and an $8 month increase by month, and then it's pre-tax.
Before it was pre-tax, yeah.
Yep, and then it's pre-tax, so for family coverage, it's probably
Double that.
2.5% that, so we're talking $16 to $20 a month increase. So we are suggesting because there's been an increase, we've followed the dental utilization for the last 3 years, and it keeps going up and up and up. And, the county's been kind of funding it based on the shortage of what our employees are funding. So we want to, bring that up to what fully funds the plan, since the plan is voluntary. We marketed the dental plan this year, so we went to the top carriers, Delta Dental, Emeritus, Cigna, MetLife. We're still recommending Delta Dental, which has the largest network, good discounts, We've had no issues with employees. They seem to enjoy that plan. So we are suggesting take that 20% increase, pass that on to the employees. I've already kind of expressed what that means to them. It's not like a huge change in their payroll deductions for the coming year. Any questions on dental? No,
I don't think so.
because I think we're at the last slide.
Okay.
Any questions in general?
I just want to make sure with staff, when I came on board, I refused all coverage, so y'all not pay anything on me, right?
I don't know personally, but I would assume since you refused it, no.
Okay, I just want to make sure that somewhere it didn't get missed, you
We
know?
will double check that, but I'm certain that if you didn't fill out a bunch of paperwork, you didn't get any.
Yeah, well, I got Humana and all that stuff, so state employed retiree, so I don't need it.
Any other questions? All right. Well, thank you very much.
Thank you for your time.
Thank you. And next on our agenda is Cabarrus County Schools, and we have the chairman of the school board here, Rob Walter, and I know you have a number of board members in attendance, so if you'd like to introduce them. I know we all know them, but when the red light's on, there we go. And so if you want
Good
to
afternoon.
let us know which board members you have, and welcome. Any
Thank you. Again, we'll have our superintendent and our CFO here shortly. But yes, thank you. Thank you all for allowing us to be part of your retreat today. I mean, I do have some board members that are in attendance, and I do like to recognize them. I've got Greg Mills, our vice chair, Pam Escobar, Catherine Moore, and Sam Treadaway are our board members. And again, they're here voluntarily. They don't have to take time out of their Saturday to be here to show support, to advocate for our school system, our staff, our families, and most importantly, our students. So it's good to have them here. So again, having a top 10 school system really doesn't happen by accident. I've said that a number of times. It's really a dedicated group of board members and school leadership team that work as a team. We have high-quality staff and teachers, our stakeholder involvement, and of course, while we're here, funding. We value our partnership with the commissioners, the collaboration, the investment that you've made in our teachers and our staff and our administrators, and the number of programs that we have, and then, of course, our facilities, which continue to grow. Now serving over 35,000 students. So what we're doing now collectively is impacting our next generation here in Cabarrus County. So as you've seen for the last 2 days, we've got a growing county, growing needs, growing expenses. It's the same here with the school system. We're experiencing the same thing. So we all have a very difficult job here making decisions. So we've got a presentation. You've asked us a couple questions ahead of time. So essentially, we're going to provide an overview and share some successes and challenges that we've got. We'll review our strategic plan priorities. We'll share how local funds are being allocated. And then we're going to review our historical and current capital and facilities and maintenance projects for you. And then we'll end with the sharing of our 2025 legislative priorities. So with that, I'd like to introduce our superintendent, Dr. John Kopicki, and our chief financial officer, Mr. Philip Penn. And they'll go through the presentation and answer any questions that you have.
Thank you.
Press the button. A little harder.
So you were trying to tell me something right off the bat there. So I thank you very much. I thank Mr. Walter for that introduction and for kind of weighing out some of the items that we have here for you today. I'd also like to thank the board members that are here also this afternoon. I believe Greg Mills, Sam Treadaway, and Pam Escobar are here. Did I miss anybody? And Catherine Moore is also here as well. So I want to thank them for taking some time to spend this afternoon with us and to be present. I think that's important. I think when your board is involved in collaborating with your administration and your teachers, I think success is the end goal there. So I do appreciate that. And one thing I can say about our board is that they're definitely focused on kids, which is refreshing, and that's what we're all here for. So I thank them for that. Mr. Measer, Ms. Lindsay, Mr. Wortman, Mr. Pittman, and Mr. Shu. I know he's not here too. I Appreciate the time you're giving us this afternoon, and I also appreciate the collaboration and support you have demonstrated to us over the years, and we're going to kind of get into that right now. So myself and Mr. Penn are going to present this. We'll try and make this as brief and painless as possible. But if you have any questions along the way, please don't hesitate to ask. So we kind of start to the 3 questions that we were given to try and show some of the things that are going on in Cabarrus County in terms of the funding, what you've given us, what our strategic priorities are, and some of our current and past performance. So the first thing, it begins with our mission and who we are. And our goal is real simple. We want to empower students to build their futures. We want to do that by inspiring their minds, engaging their hearts, and shaping their futures. And it's not just the people in this room that do that. It's the 4,700 employees of the district, the teachers, especially the teachers, administrators, and all the people that are involved in that, as well as the community members and the parents, and many of the different partnerships that we have in Cabarrus County that help us to continue to inspire our children. We have 4 core commitments. In brief, what we really try and do, number 1, is build relationships, and we're very intentional about that. Research is very clear that if you build relationships with kids, and if you have one significant adult that can make a contact with that child throughout the school day, consistently over the year, they will be successful. So we are very focused on relationships and making sure that we're establishing those from our central office all the way through the system. Again, it's not just our teachers and administrators, it's our maintenance workers, it's our S&P workers, it's our bus drivers. To be point of fact, our bus drivers may be the most important people that work in our district because they're the first person that they see every morning and the last person they see every afternoon when they go home. And our bus drivers are fantastic and do a great job at making sure they build those relationships with their kids. We value the whole student. We want to make sure that we're meeting their needs. We preach all the time and talk a lot about access, resource, and opportunities. Are we getting our children the capability to access all the resources in the district so that they can pursue the opportunities that they're after when they're in Cabarrus County school system? And we want to be future-driven. We're educating kids for jobs, as you know, that are not yet invented, and our world is rapidly changing, so we want to make sure that we're keeping future-driven in mind at all times. So some of our successes, 93% of our folks tell us that they are satisfied with where they work and they are pleased to work in Cabarrus County. Not sure what it means, but it's nice to see that the Independent Tribune recognizes us as the #1 place to work in Cabarrus County. You take the accolades when they come. I was always told to ride the wave when it's good, so I'll ride that wave as #1 in the county. And I think this tells a lot about our academic success. We're extremely proud of this. 115 school systems in the state of North Carolina, we continue to be in the top tier. Last check, we're in the top 15 school districts academically in the state of North Carolina. One thing we were laser focused on, and is very important to me, is increasing that number you see on the right, 91%. It was 88.9% 2 years ago coming out of the pandemic. Right now it's at 91% and climbing. I believe that's the second highest graduation rate that Cabarrus County has ever had. We are pushing that number every day to get that higher and higher. And I can tell you that's a big deal to us, and we want to make sure that our kids not only enter the system but graduate from Cabarrus County. So at 91%, while still leaves 9% of kids that we need to catch, we're on the rise, and we're very proud of that number. When you look at some more academic data, it tells you some of the story as to what's going on as to how the state and it looks at us and how most of the news media reports how schools are doing in the state and across the country. While I want to point out this is not all inclusive and it doesn't tell the entire story of a school, it tells a piece of the puzzle. And it also tells how we're doing in relationship to the state and in relationship to the other schools that are out there, the charter schools in the state of North Carolina. We continue to outperform them. We have 3 times as many A schools. You can see mostly B and C schools follow that, and we do have some areas for improvement, something we talk about all the time, continuous improvement. There are some D schools and 1 F school that we need to focus on and make sure that we are providing those access, resources, and opportunities for our students to succeed at those schools as well. But as you can see overall, academically, we are performing at a high rate and in a very successful manner in Cabarrus County. One of our partnerships is with Rowan Cabarrus Community College. We're proud to say that we've given out 93 associate degrees. So what does that mean? That means when our kids graduate high school, 93 of our students had associate's degrees. And if you do the quick math on that, that's 2 years of college that they saved that they will not have to pay tuition to if they go to a 4-year college. It also means that they're probably skill ready to enter the workforce. We don't want to be naive. Not every child is going to college. And in today's day and age, it's very important that we focus on the CTE pathways, which we have 52 of them, as you can see, and make sure that we give those opportunities to our kids that maybe are not college bound, but are ready to become an entry level and go into a business field or an entrepreneurship or something that they're interested in. You know, and this is always profound to me. A week ago, I know I could change my own oil. I know how to do it, but I don't like to touch my car, so I bring it into the dealership, and I had my oil changed last week, and up on the top, it shows you the price, and it says labor, $100 an hour. So that's profound when you think about it, that we're preparing our kids in the auto industry and the engineering industry with all of our STEM programs to walk into a field where there's a lot of technology, and they're going to earn a great living. I mean, I knew it was high. I knew the labor cost was high. When I saw the $100 an hour mark, I was like, whoa, that's pretty good for a child coming out of school making $100 an hour. So it also drives the point home that we have to be committed to the pathways of the CTE and make sure that we're continuing to give those kids those opportunities. 48% of our kids are coming out of our system with college credit. Again, that's through our partnership with Rowan and Cabarrus County and the Career College Promise. 98% of our kids are either going to 2-year, 4-year, or military or into the business world when they graduate from Cabarrus County. And right there, you can see a $4.3 million increase in our scholarship funds as of last year, and climbing. So we're pleased with that. Our kids are continuing to achieve and gain those scholarship opportunities to go to college, or 2-year, or into a field that they are pursuing. We have a healthy IB program. 72 students took that exam last year and passed it. We have a world-class VEX program that our kids compete at the world stage and win. And I always talk about our kids compete at the local level and are successful. Our kids compete at the state level and are successful. And they continue to succeed across the nation, and they're very successful. So when our kids leave Cabarrus County, they're representing you in an extraordinary fashion and being very successful in whatever they do, academically, athletically, entrepreneurially, whatever they touch. When they go and compete, they not only compete, but they win. And this is a great statement. This World Championship, I'm very proud of our kids for this, because this is against the world, folks. All the continents are there. All the kids from all the world are there. We've gone to Dallas, Texas the last couple of years, been successful and won. So it's not just competing with your classmate in the same room or another school district across the way from you. This is the world, and our kids are competing at a highly successful rate, and we're proud of them for that. The last bullet there talks about a collaboration that our teachers involved in, a global collaboration. Again, it speaks highly to our faculty and our staff, as that they're always seeking opportunities to improve themselves, to bring that knowledge and experience back into the classroom. So we are proud of our teachers as well. They are outstanding at what they do. Demographics, quick snapshot of what do we look like today. As of today, we have 35,161 students. You may ask the question, you were at 35,366 back in the fall. It always drops over Christmas because of early graduation, and there's some transition going on. That number will ascend upward as we go to graduation. But we're a healthy 35,161. You can see the ethnicity and how we're breaking down and how our diversity is changing over time in the Central Cabarrus School District and in Cabarrus County as a whole. And you can see kind of our enrollment, some of the subgroup data that we deal with. 43.9% of our students are coming to us in a free and reduced manner, meaning that they're below the poverty rate. That's about 12 to 15,000 of our students are coming to school every day living below the poverty line. So that's another challenge that we have to make sure that we're prepared for, that we educate all students and meet their needs. The other one I'd like to point out is our EC population has continued to grow. We're at about 11.3%. I believe that number is slightly over 12.1% today. So that has changed. So that continues to climb. And this is a snapshot of our enrollment over the last 10, 12 years. You can kind of see that ascending line going up. Right now, this one I believe says 35,235 on it when we took that snapshot. So again, the numbers tell the story that the growth continues to happen and occur, and it's in pockets of our area and our district that present some of those challenges to us that we may talk about today. Our priorities, you asked what our priorities are. I provided you with a copy of our annual report that you have there, as well as the Engage magazine that Mr. Phil Furr of Director of Communications has put together to tell the story about things that are going on in Cabarrus County and doing well. And also, I'm not going to go over this in great detail because I know time is of the essence, and you only gave me 3 hours to speak, so I want to make sure that I get all that extra time in. But these are our priorities: student wellness, teaching and learning, the diverse talent pipeline, early learning, technology, enhanced learning, community alignment. Focused on kids, focus on our community being involved in our schools, focus on that future enhanced education that we talk about, trying to meet the diversity through our hires to show that our faculty and staff look like the kids that are walking into the doors. And the bottom line is making sure kids are well to come to school to be prepared to teach, to be prepared to be taught and learn. So again, these are our priorities. You'll see the goals in the book, and then the goals break down to the objectives of each year. You have the current 2024 report. We hold ourselves accountable, and I am accountable to my Board of Education. That's one of the key things that they look at when they evaluate me. Did we meet that goal? I can tell you last year we hit about 85% of the goals that we set out to achieve, and still working hard to meet the goals this year and hopefully exceed the 85% mark. But I'm very, very pleased and very proud of that 85% mark. That's a total team effort. Folks like Mr. Penn, Sarah Reeves, John LeGrand, Jonathan Bowers, Michael Williams, Mary Beth Roth, our whole team and our administrative team, all of our principals and teachers pulling together to achieve the goals that we set for the district, to make sure that we're hitting our strategic priorities. Again, you can review those. If you have any questions, do not hesitate to ask me or give me a call at any time. We'll be more than happy to go over with you. But it's there for you to peruse and look at as well. If you should lose that, information is on our website as well. I'm going to hand it over to Mr. Penn right now to talk a little about our allocation of local funds that the county supports us with. Mr. Penn?
Terrific. Thanks, Dr. Kapicki. So to answer the question, how do we look at the way that we spend our local dollars here? The biggest bucket that we have, and you'll see it both broken out in the pie and in the table, is certified salaries and benefits. That's for our certified staff, classroom teachers, and people that act as if they're, within a teaching license capacity within a school. Now, included in that figure, and it's about 254 people right now, is about 18 million plus that we use for our certified supplements. Cabarrus County very generously upped the supplement to 13% of base salary in the last budget cycle. You are required under state law to pay supplements out of local funds. You cannot use state funds to do it. So that makes up a pretty good chunk of that certified portion. Classified salaries and benefits is the next biggest piece. We have about 300 people that are classified staff. That can be anything from folks working in the HR and accounting office like myself, on down the line to people that work in facilities and maintenance, in the technology area, some of the clerical staff that we have. That's the second biggest piece. Facilities maintenance, that's the actual upkeep of the buildings that we have. It's not the major projects that we have in the capital budget, but the day-to-day maintenance that we perform. Similarly, technology, it's the maintenance and the software that we have that keeps the district running and safe from outside intrusion. Contracted services, and within that, some of the bigger buckets that you would find in there would be the contracts that we have with our school resource officers, or SROs. That's about a third of that figure. Legal services would fall into that line. We were budgeted to spend about $500,000 on legal services this year. Our athletic trainers, about $325,000. Traffic control that we typically have around the schools at the beginning of the school year as parents get used to the drop-off lines and that type of thing, right? Roughly $185,000, and things get smaller after that, pretty progressive, pretty fast. But those are some of the things that would fall under contracted services. Utilities are exactly what they sound like. That is our water, that is our electricity, that is our natural gas that we have, that we keep the buildings lit and warm during the wintertime and lit and cold during the hotter months, right? Instructional supplies, those go directly out to the schools. That is how they keep their consumables replenished every year. They also buy minor software packages that support student learning directly through the schools that way. But one of the things, for instance, that we did starting 2 years ago was, as we were starting to do all the budget meetings that we had with the schools, was making sure that where there were commonalities to those purchases, we were taking advantage of district level pricing. In other words, if we had 20 elementary schools buying the same software package, it made a lot more sense for us to buy it at the district level and then use dollars from the schools to support the actual purchase on a pro rata basis, right? So that's one of the key changes that we've been making over the last 2 years. And then all other, frankly, is kind of everything else that didn't fall into one of those categories above it. But you would have things like diesel fuel for buses for our activity buses, things the state won't pay for. You'll have tires in there for the same reason. But it's anything that wouldn't fit it neatly into one of the other categories kind of becomes the all other. And you'll see the subtotal I have there for 92.almost 8 million. And these three negative lines that follow on after that. And I wanted to sort of be genuine to the way that the county allocates funds to us, right? So out of that 92 million, there are alternative funding sources like fines and forfeitures that come to us, right? In addition, the interest income that we generate internally on our cash balances is worth about $400,000 a year. And then we have a special revenue fund that we also use to pay for some of those items. This year, that was budgeted about $4.4 million. The biggest pieces of those are Medicaid, money that we receive for reimbursement from the federal government for services that we provide to our students. And then the other piece is indirect cost recovery. So indirect cost means for federal grants that we receive, we're allowed to charge, I think it's up to 8% of the grant value to cover our overhead that comes back to us from these federal programs. So we sweep that back into an account to pay for some of the things that are on here. But I wanted to make sure I was kind of being clear about how do we go from 92.8 million down to the 85.8 million that really is tied more directly to property taxes that are generated locally that support education.
I've got a question.
Sure.
So you said the difference between the certified and the classified.
Sure.
Certified are teachers in the classroom.
Typically somebody who needs a state license to do their job.
Okay, and now how many fall within that category?
Now, this is local only,
Yeah,
right?
right.
Right, so it's 254 currently.
Okay, and then for the classified,
Just
this
on-
is administration, is that correct?
It could be administration, but it could be, our mechanics, it could be our carpenters, it could be our electricians, it could be our IT personnel. There's a lot of people that fall under classified.
Okay.
But typically, somebody who doesn't need a license to perform their day-to-day job,
And
I
how-
say that, but of course, an electrician's gonna be licensed, right? But you understand what I'm
And
saying.
what's the number on that?
Right around 300.
Okay. Could we get a breakdown of that?
I
would like
literally
to.
just gave it to Rosh and to, yeah,
Perfect.
so
No,
if you wouldn't mind.
And it has the
Yeah.
job title, salary attached, that's what I would like to see, a breakdown
It
of.
breaks it out across all the different funding sources as we have, not just local, but you can
Okay.
see how federal plays into that, you can see how the state plays into
But I'll
that.
be able to dive down into that, is that
Yes, you would.
correct?
You'll have the FTE, full-time equivalents, in each of the job classifications,
Okay,
and the total salaries that are applicable to those FTEs.
okay,
Yeah,
all right.
okay. Would you mind forwarding that? Yeah. You don't mind forwarding that to them?
Yeah, we've got that, Rosh,
Okay,
Rosh
right.
and I will.
Okay.
send that to you.
Perfect. Okay, no, fair enough.
We
Sure.
had requested it last week in
Yeah.
anticipation of some of these conversations.
Yeah, okay. Any other questions on this slide? Yeah, okay, let's roll to the next one, please. So, when we look at the total cost to run the school district, one of the things that we look at is, reading from left to right here, it's state public school fund, that's money that we get from the state of North Carolina. Our local current expenditures, and that's the piece that most directly tied to that 85-ish million that we saw on the previous page. But I also want to point out that one of the things that I did not include on my pie chart was what the county is responsible for paying for the charter schools, right? That was budgeted, you'll see it there, at just under 6.5 million, 6,471,000, I think the last three digits are 601. That's trending higher this year and could be as high as 8 million next year, right? So that is something that we effectively serve as a pass-through entity. We receive the money from the county, we pay it out to the charters, right? And it's all determined by state law what amount of money you need to give them, and it's something that we reimburse them on when we're invoiced monthly, right? You'll see the federal grants fund, you'll see the local special revenue fund, that's that 4.4 million that I was talking about earlier, for instance. It's an offset. There's other stuff that flows through there. And that's how we think about the operating budget, those first four buckets. And then, of course, there's the capital piece, child and nutrition, and Kids Plus, in government accounting terms, those are enterprises, right? They don't really function the way that most governments do, in that they charge fees for their services and are recovering most of their fees that way. So child nutrition, for instance, is able to go out and get reimbursements either through the federal government for their meals that they serve, or for a la carte sales that get made during the school day at the school. But when you look at the total, and this was the initial amount that we had set for the budget for this year, it's about $470 million. And I just wanted to provide some context around what does it actually take to run the schools here. And I will tell you that as additional state funds have dropped in, as the capital has come in from the county, that figure now is closer to $540 million, which I think is more indicative of where the run rate is to run the schools. So, there is a piece that's local, but there's it's in the context of a much bigger piece that we're over $500 million a year to support the 35,000 plus students that we have here, right? I just wanted to make sure we provided that context. All right. So one of the things that the state of North Carolina publishes each year is a look at per pupil expenditures, or PPE. And this is kind of interesting to me because they break it down into three different buckets and then a total. What's the per pupil expenditures that we have coming from state funds? What's the per pupil expenditures we have from federal funds? Per pupil expenditures that we have from local funds, and then what's the total? So what you'll see here is the ranking of us and some neighboring districts for the 23-24 school year. Well, out of 115 school districts in North Carolina, we ranked 114th out of 115 in terms of total PPE. That 11,039.73 was 114th out of 115. In 22-23, we were dead last, 115 out of 115. And as I said to Dr. Kopicki at the time the 2022-23 figures came out, I wasn't really sure if that was something that we should take pride in and feel good about, that we're being efficient with the use of our money compared to a lot of the other school districts, or if that's something that says something about the funding that we receive because of the demographics that we have here, right? I try to tie this data into median household income. And when you look at median household income by county in North Carolina, right now Cabarrus County is ranked 7th. When you look at like Union, they're ranked 2nd. When you look at Rowan Salisbury, they're at 36th, right? So, you try to put that in the context of, well, why don't we get the same kind of federal assistance that some of these other counties do? And why is our per pupil expenditures for state not as competitive as we are for some of the others, right? But I think it's like when you go back and you look at sort of the dichotomy that we have here in the county, when Dr. Kopicki mentioned earlier, 40+% of our students qualify for free and reduced lunch, and our median household income is 7th in the state, right? And that to me says we have sort of this bifurcated income where you've got a lot of folks that are not making a lot and a lot of folks that are making a fairly high income. And the median puts you in a place where you're not qualifying for some of the aid that some of the other counties around you are going to qualify for. You're certainly not going to qualify for a low wealth, and you're not going to qualify for some of these other programs that are out there. And it sort of speaks to, when you look at how low we are on federal PPE at just $1,000 per student compared to some of these others. Would I love to have another $3,000 or $2,000 per student for federal? Sure. But my demographics aren't going to get me there.
So Rowan, Salisbury schools, I see their federal contributions a lot more than Cabarrus County.
Right.
How are their test scores or ratings compared to Cabarrus County?
Go ahead. Chris Hart. There you go.
Turn it off next time. So what I would say to that is we outperform them. As you saw the slide earlier, we're in the top 15 in the state, and in some categories we're even higher than that. So I think what the data tells you, the evidence says that we are operating in a very lean capacity and still outperforming the rest of the state academically at a very high rate. So we're being efficient with the amount of money that we're getting, and we're still producing high academic returns.
So
Doesn't mean we can't improve, but I think the data speaks to the achievement levels that our students are maintaining and continue to improve upon. When you look at the last 6 or 7 years, we've gone from 35th to the top 15, and again, in some categories, we're even higher than that.
So our scores our ratings are better than Rowan and
Yes,
Salisbury.
I think on that sheet there, I believe the only one that may be higher than us would be Union County.
So even though they're receiving a lot more funding, throwing money at the problem, it's not solving their problem, I guess you could say.
Well, one could interpret it that way, Mr. Mees, correct.
Just curious.
Yep.
Other questions on that slide?
And when we look at our capital updates and the investment that the county has given us over the last 10 years, you can see some of the projects that the county has supported, and some of the project costs there in the year it was completed. I believe that when you look at this, what you really want to take a look at is some of the pricing was interesting. You look back at what it cost 9 years ago to build Old Elementary, and then what it cost in 2024 to build Arbor Cow, so you see a significant increase in the amount of cost and what it costs to build a school today. So there's some of the indicators that you look at when you see what it costs to build a school. You look at Mount Pleasant Middle School, what it cost you in 2017, and you go 5 years later and look at Roberta Road, what it cost you to build that. There are significant investments, and the expenses are continuing to accelerate as we move through the years in our capital projects. But again, these are what the county has completed over the last 10 years. Mr. Penn?
Yeah, the only thing I think I would add to that is if you look at the total of this list over the last 10 years, it's somewhere north of $300 million in capital expenditures and construction, which would take the total invested assets that you have in schools somewhere north of 2.7, 2.8 billion, in that range. And what that tells me, and I think you're going to hear this when we get to our budget presentation with you in a few weeks here, is that as that population or as that invested asset base continues to age, the cost of supporting that also continues to grow, right? When we talk a lot about deferred maintenance, this is kind of what we're talking about. You know, when you consider that the oldest project on this list is now 10 years old, right? But there's a lot of other schools, 30 plus, that aren't shown here that are significantly older. And so I'm becoming more increasingly concerned, just from a budget management perspective, on making sure that we're investing enough in the ongoing maintenance needs to support what we already have here. You know, I don't want it being something that looks like the county and the taxpayers here have invested $2.8 billion, and we're not being the kind of stewards of that capital that we should be, if that makes sense. Yeah.
Well, and we appreciate that. We had Kannapolis City Schools here earlier today, and they had explained how, you know, obviously they have older facilities, and they're, you know, putting in the money for the maintenance, maintain them. So we're not having to build brand-new facilities all around Kannapolis. So thank you for putting that into the existing facilities and trying to keep those running so we don't end up in that situation.
As we move forward, you can see some of the FMD capital outlay projects that the county has invested in over the last 10 years or so. This adds about about $41.6 million, all told up when you add it up, which means it's about 4.1, give or take, $1 million per year in an aggregate total of what you're investing in the county. But you see with a lot of those projects are, including the most recent projects of the Wolf Meadow, Hickory Ridge roofs, Concord Middle School, Weddington Hills, and Cox Mill's roof, and then Concord Weddington Hills HVAC systems. They're currently in progress right now. And you can see the amount of money that's been spent there as well. So there has been some significant investment in a lot of the projects over the last 10 years, and this would represent that.
Yeah, the only other comment I would make here is obviously as we complete a project, and if it leaves funds left over, it becomes something that we try to make sure we're still continuing to be as efficient as we can be. And I'll draw a very current example of that. The roof at Central Cabarrus High School has been problematic for us and has been on the project list for over 2 years now, because the quotes that came back on 3 different bidding cycles that we went out to were substantially higher than what was originally allocated for the project. So one of the things that we try to do is work fairly closely with the county staff to say, is there a creative way that we can harvest money from other projects that have been completed or use other funding sources to make sure that the work is getting done? And we're going to be coming to you in a couple of weeks with a proposal exactly along those lines, right? So, you know, to the extent that we're able to complete these projects for less than what we originally had budgeted, it's not like the money goes to waste in any way, right? They get reinvested into other projects that we know are needed, and when there's a need that for a commissioner approval, we'll come back to the Board of Commissioners with, here's our plan. Are you in agreement with us moving forward to solve this issue that's out there? You know, and I don't want to get too far ahead of myself on that presentation, but you'll understand why it's a critical need now to solve that and why we think we've come up with something creative that will address it without creating any additional cost to the county.
Well, I think it's also important to point out, like with R. Brown McAllister, when we walk through that, you guys are proactively looking at things. You've brought the HVAC units from on top of the roof to inside of that building, which extends it, I believe it said 10 years.
Something like that.
And also the access points in between the
Yep.
bathrooms to where you can fix that for cheaper. So this looks like it is a lot of money, but I would like to point out, you guys are proactively looking at ways to cut down future costs. So I appreciate that as well.
Well, I appreciate acknowledgement of that, and what I would say, that's a credit to Tim Lauder and Brian Cohn and the work that they do on a consistent basis and the value-added assessing what they do on projects. So what the initial price is, usually, in most cases, we get under the initial price and save the county money. We try and be very efficient and very judicious. We take it serious. It's taxpayer money. We want to make sure that we're being responsible with that and that award. So I think that team does a nice job at making sure that they assess the situations. And
Can I ask a question?
yes,
real
ma'am.
quick? Thank you. So when you guys do a project and it comes in under budget, that bucket of money that you save, where does that go?
It stays within the county's capital budget.
So
Right.
it stays on this
The
side?
county's books, that's right. We reconcile at least quarterly between our books and the county's books to make sure as these projects close out, we're reconciling it the right way. Yeah. Yeah.
And again, to talk a little bit about some past performance and where we were and where we are, this is the 22-23 capital plan project list. It was a fluid list. It changes based on the data and the evidence that we're working with on any given year. But you can see R. Brown McAllister has been completed. The land for the Southern High School long-term has been purchased. Cabarrus Health Science Institute, I'm happy to say, is in its third year of operation and thriving. That is probably one of the crown jewels of the area right now in terms of a unique, innovative way our kids can go to school. Our kids can go there and basically come out of there with an RN degree, as one example, if they pursue that particular pathway. Some of those partnerships, again, with Atrium Health and others have been incredibly beneficial and innovative for our kids. Great situation that you have supported. When we look at 24-25, the current year, you can see the three projects that are in play right now: the Opportunity School, the Pre-K Center, and the Replacement School, which is a mirror image of R. Brown McAllister's, little tweaking on the layout. But those three projects are underway right now. And then the fourth elementary school, while approved last year, has not yet been started in terms of construction. So that's a 24-25 capital plan projects that's underway currently. And we'll bring the 25-26 plan to the county at our budget meeting. We can discuss that. I have to first go to our board and get approval from our board. We'll be doing that over the next month and getting their input as well. When you look at the deferred maintenance projects that Mr. Penn talked a little bit about, you can see the table there. Yes, ma'am.
So I wanted to go back to the capital
Sure.
projects real quick.
There you go. This one?
Yeah, so that's the 24-25. Now,
Yes, ma'am.
Royal Oaks, the high school edition,
Mm-hmm.
has that been just kind of,
Well, we're in discussion as to what the 25-26 plan will be that we'll present to the county. Again, I have to go in front of the board and get their recommendations, insights as well. I can't say that it'll be totally taken off or not. We've had some good discussions with their board members on different ways we might be able to incorporate that. I do believe that it's, right now, as it stands, it's on that 25-26 plan, but it's not near the top of the list. It's more towards the back end. And depending on what kind of support we get, and I mean in a positive way for any of the high school projects, there has been some talk about maybe consolidating, not consolidate, it's the wrong word, about including the arts program 9 to 12 in new high schools. So there's a way to save money there perhaps, that we can kind of include that within one of the builds.
okay. And then Number 7 with the Southern High School.
Yes, ma'am.
So that's the one in Midland.
Yes, ma'am.
Okay, I had asked Kelly earlier, and we didn't know the answer to this. How do we come up with the titles for these high schools? Like, rather than calling this Southern High School, would it be possible to call it Midland High School?
So I think when that project takes fruition and it's being built, you know, we go to our board and our Board of Education and get some input from the community and decide on what the name is. And you can see throughout Cabarrus County, there's a lot of historical names, and there's a lot of geographical names, and there's some other ways you've named buildings. It was called the Southern High School because the land sits on 2427. It's in the southern part of the district. So there was no name designation at that point because it was just the land. So we were just trying to identify that area.
And I get
You
that.
want to be careful before
Well,
there's an
yeah.
actual process that people can submit things.
And maybe not necessarily to call it Midland
Mm-hmm.
High School, but I guess just on here, kind of like we have Concord High School, but I also know that we have
Yes.
Northwest High School. So, I mean, there's both ways to look at it, but that was something that was brought up as a suggestion
Sure.
from the Midland area, if they could, even just on the planning part of it, could it be
Sure.
called Midland High School?
Yeah, the land itself sits in the Midland boundary,
Right,
off the 2427 area there. It does sit in the Midland boundary, correct?
okay.
Perhaps Southern High School and Midland would be a good compromise, right? You know, just something that acknowledges the geographic location of where it
Right,
is.
exactly.
On number 1, is that the Performance Learning Center?
Number 1 is the Opportunity School. Right now, our Opportunity School is in the Glenn Center. So our long-term plan is to get all of our personnel, or all of our academics and our offices out at the Glenn Center, return that back to the county, and the county can then decide what to do with it. That is being built right now near the PLC. I'll show you a picture of that. We have a
And
picture
the
of
only
that
reason I
coming up.
asked is because if that was I was going to have you explain how many students that PLC has actually saved from dropping out,
Oh.
and how vitally important that school is to our system. That's where I was.
I can tell you right now, between the two schools, we have 134 students attending them. You're saving lives in a lot of ways. The Opportunity School, a lot of times, it's just that's an opportunity for kids who may have made an error, mistake, for it to kind of regroup, work with Beverly Mack and the faculty over there, and kind of, you know, take some time to get the right preparation to possibly go back into the regular education setting. Some kids graduate from there. It's the setting that they need. The PLC is very unique, very non-traditional, and without question has saved lives. So again, it's another innovative way that Cabarrus County probably is different than a lot of counties and a lot of districts throughout the country. When we talk about all kids being relationship focused, is another example of that.
And these things don't happen without a partnership and collaboration with the county.
I just want to draw attention to the fact that this is New Southern High School, and everywhere else I've been seeing it is Southeast High School. So I don't hope that doesn't create any confusion anywhere along the way, but, you know, it's being called two different things already, so.
Well, I think we'll go back, Mr. Pittman, and take your advice and Mrs. Lindsay's advice and highlight that that's the Midland area that we're
Right, that's
talking
what I was
about.
gonna say.
We can do that.
Add that in, so either way it's named or temporarily named until we get there.
Yes,
I know
sir.
you're talking about Midland.
Yes, sir. Any other questions, Ms. Lindsay? And again, we'll be bringing you the 25-26 plan at our budget meeting in the near future. These are the FMD projects. This is roughly $7.9 million worth of projects that are undergoing, that are taking place right now in Cabarrus County. I apologize, I'm looking down because my eyes cannot see that small print, but I know what it says. You'll see the design phase. It's either in progress. I have a much larger version of this presentation on my phone. So you'll see it's either in design phase, bid phase, or in progress. So the caption on the bottom kind of tells you that, so you can look as to where you are and what part of the progress that particular project is on. This is what we always refer to as our top 36. And again, this was $7.9 million last year. Mr. Penn?
Yeah, so when we look at the capital plan, there's a couple different pieces to it, right? There's construction. There are these projects that are between $25,000 and $499,000, and there's the projects that are not construction, the way we think of building a building, but could be an HVAC system or something that's got a fairly large ticket attached to it, of $500,000 or greater. And the commissioners last year approved all 36 of the 36 projects that we had put forward on the list. So you'll see that we're making some pretty good use of those funds to get this work done. It is a process, right? A lot of the stuff has to be bid out, right, because the taxpayer dollars involved and the price points involved. But we were very pleased to see that the board had elected to come forward with all 36 of those. And that's an annual process that we go through as part of our capital budgeting cycle, is when the facilities team will meet with their discipline leads, electricians, roofing people, things of that nature, and populate out of the projects that we're tracking that need to get done, what are the top 36 coming out of them. So there will be another list of 36 that we present in the next capital cycle. It reflects, you know, if you want to think of it, of 37 to 72 here would have been our list at that point. But the prioritization shifts, as it should, right? As something becomes more of a critical need, we'll elevate it on the list and make sure that that's refreshed each year.
So what you'll see now, real brief, is some of the projects taking place, and we've kind of talked about them a little bit, but this is the replacement elementary school project that is being built on Coltrane Webb. Again, it's a mirror image of R. Brown McAllister, same footprint, same building, just kind of laid out a little differently on that site. This is the Opportunity School being built right next to the PLC. This is what that will look like. You have the descriptors there for you.
How much money were we able to save by using the same plans from our McAllister School to
Strictly on the design, it was over 700,000, I know, we saved.
Yeah. It's definitely a good financial move. This is the Mary Frances Wall Pre-K project. This is the rendition of Northwest Cabarrus High School project. We show this because even though it's not underway, there has been over $8 million already invested in this project. And I can tell you clearly, this will be the number one recommendation coming from the administration to the board, and then we'll see where that goes as it goes to the county coming up in the next month. But again, there's been $8 million already invested in design and architectural drawings and renderings and things and engineering up to this point on that particular project. These are some of the HVAC renovations that we've talked about a little earlier. This is the Concord HVAC renovation, the Weddington Hills HVAC renovation. You'll see the various roof replacement projects that are going on. And in addition, Mr. Penn already highlighted the Central Cabarrus project that he will be coming to the county with shortly. Then we include this to close the presentation. These are the legislative agenda items, the priorities that our Board of Education is recently, and I know many of you board members were, county commissioners were at that meeting, proposed. And you can see they align a lot with some of our strategic priorities or initiatives and some of the things that we're talking about in terms of connecting the local funds to some of the priorities, to the current and past performance, to making sure that we're all talking the same language and promoting the best for kids in Cabarrus County. That is all I have, and if I have any questions, I'll be happy to engage in answering them, along with Mr. Penn and Mr. Walter.
regarding, so with the Northwest Cabarrus High School project, seeing as how that hasn't even really been technically approved yet, what did the $8 million in investment already go to pay for?
So to my knowledge, that's a lot of the architectural renderings, the design engineerings. There may have been some surveying, well, there was surveying and groundwork, but I would have to go back and check with Tim Lauder and Brian Cohen. I can get that for you Monday morning, exactly what it is, but I know the figure is slightly over $8 million.
Is that, just help me understand,
Sure.
Is that normal to make that much of an investment in something that hasn't already been approved for?
It's a fair,
capital?
yeah, it's a fair question. That project kind of had wings before I arrived, and I'm not trying to kick the can down the road or say, hey, not my responsibility. It is now. I mean, it's our project now. I would say it's not unusual. If you have purchased the land, it was targeted on a previous capital plan. I don't want to presuppose any discussions took place with previous administration and boards, but I can't imagine that the project got that much momentum and this much progress without some conversations taking place. Some of our board members are new, some of the county commissioners are new, so things evolve over time. You know, and I don't mean this in any flippant, sarcastic way, but, you know, when you say describe normal, it'd be like, I think normal is applied differently to different situations, right? I don't think it's unusual, but I'm not going to sit here and say that I was privy to all those conversations and decisions, because I was not, nor were you, nor was the current board sitting there. But I can tell you that is a project that is in dire need to occur. The current Northwest High School is in bad shape.
Oh, yeah. No, there's no denying that.
Yeah, we've had some serious water issues out there this year, and the population's booming out that
And
way.
again, the need was there. It was designed, but the project is, what, 50 million more than we had expected at the time. So obviously that puts some pressure on what to do next.
If I could draw a parallel to a current project that's underway with the 2 new elementary schools, one for Coltrane Webb and one yet to be fully funded. The county had set aside about $1.5 million for each of those 2 projects to fund the pre-work that needs to get done in order to have complete packages of materials to come back to say, how much is the school actually going to cost, right? Because there is a fair amount of work that has to take place in design, architectural work, all that type of thing up front to be able to have a complete package to come back to and say, we now know that this school's going to cost X in terms of the hard dollar cost for the construction.
And moving forward with the lobs or geo bonds, if we're going to permanent financing from the start, you have to have it pretty much bid completed. So we will have a lot of money invested in them by the time they get to permanent financing.
And again, I'm not trying to be elusive, it's just a lot of those conversations took place before many of us were here. Any other questions?
Go ahead.
Just a side question, if we have that much money invested and it goes to general obligation bonds and it doesn't pass, what happens then?
So as I understand it, and again, I'm not an expert in this area at all, I believe we would have to wait a minimum of 2 years before we went back to find a funding option, whatever that option is.
I'm the liaison to Midland.
Yes, sir.
And I have been talking about the fact that they are very eager, anxious to get that high school down there going. And they're not happy that it's as low as it is as a priority. They already have the land, and they do need to get the sewer extended down to them. But with the sewer improvements that's already been done, they're anticipating for too long having 1,500 houses built down there, and there's going to be a real need to get that going. Plus, there's some concern about kids from Midland being bused up to Central Cabarrus and over Harrisburg and all that. One thing that I'm wondering in the midst of all that is, say we get that done and you're not going to bus all those kids up from Harrisburg to these other schools, where would the line be, probably? How far up, say up 601, how far up would you stop busing to, say, Central Cabarrus, and they'd be going to this new high school? Have anybody thought anything about that?
I think that depends on how many students we're going to put in the school.
So I think right now, Mr. Pittman, to answer that question, the way the bonding lines are drawn, when we look at the data and the evidence, no pun intended, but that kind of drives the bus. I think purchasing the land in Midland was smart because it prepared you for growth down the road. And I think we all understand that a lot of growth is taking place in Cabarrus County and has over the years, right? So I think it was a very good, smart, proactive decision by the county to buy that land. I do think at some point in the future, you're going to have to build a high school in the south, but that's not today. And one of the reasons why we keep that will stay on our plan, but the one reason why it's farther down the list is because of to your point, the development. While we hear that it's going to occur, there are a lot of balls in the air right now, and you may know more than I, but the sewer capacity, the permitting, to your point, the water lines, a lot of these things have to take place and occur. Some of the building permits that have to be granted and accessed and all that to take place. That takes time to build those homes. I'm not a contractor, but I can, 1,500 homes are coming online, that's going to take some time to build. Right now, we have a burgeoning problem in the northwest part of the county. 73 and above 73, we're growing quicker than I can even assess. And Northwest High School is in terrible shape. We've had serious water problems this year alone. We lost a day of school because of a water main break. And I could take you through there and show you a lot of the other physical features that are causing a lot of problems with Northwest High School. Our recommendation is going to be Northwest High School. I then think, and again, the elementary schools, we all have talked about that. I think you need to take a hard look at Central Cabarrus High School because we have capacity in the high schools to move kids around. I don't want to move kids around. We were very clear when we realigned. We said we wouldn't have to touch anything for 10 years unless the only time we'd realign was when you open a new school. I think those other schools need to take place first because you do have some room in the Central Cabarrus and the Mount Pleasant area on the eastern side of the district if Midland should grow or expand much quicker than we think it will. But right now, we look at that boundary and we look at what's building there and the sewer capacity, it's not there yet. But we have the problem in Northwest, we have the problem in Central Cabarrus. And I think they should be, based on the data and the evidence that we look at and the growth that we look at, they would be prioritized before Midland. That's not being disrespectful to Midland or the constituents or saying we'll never build a school there. I think you're going to need it. But I think I would be foolhardy for me to come here and say to you, Mr. Pittman, put the Midland High School first and push everything behind that, because I wouldn't be doing my job. I would be very disingenuous and I would be being very deceitful in terms of the data and evidence that I'm aware of to say put that on the front end. That to me would be not a good use or not efficient use of taxpayers' money based on the data and the evidence. Where our kids are, where the population is, where the growth is, where the older schools are stressing and coming to stress points where we can't really continue to maintain them, that's where the need is. So I think it's just a matter of keeping a careful eye on it. What I said when we did this plan, when we did this about a year and a half ago, what I said to our board was, smart move to the county, everybody buying the land. Because as we all know, the growth is happening everywhere, and land is hard to get. And we've seen that as we've tried to acquire land in Northwest for our elementary school, and unfortunately, we're close to closing that deal. But that was a smart move. And it's only a matter of time where it's going to grow. But I think that's going to happen farther down the road than we think. And right now, I would say to you, without being repetitive, that the needs exist in other areas of the district first.
Well, I have to say that's the best, most reasonable answer I've been given yet. But I just hope y'all can understand their angst over it.
I do, and I appreciate to be frank with you, I appreciate the enthusiasm and the interest, and I'll even say the pressure to have us build that school. That shows they're involved and that they're representing what I have seen in Cabarrus County since I've been here. People care about the education in the county, and they want the best for their kids. So I applaud them for that. When I go out to Bethel Elementary and I see that school and the leadership of Julie Barbie out there, it's incredible. They do fantastic work, like all of our schools do. But I applaud them for their enthusiasm and interest. And I would say, keep asking the questions, because we'll keep citing the data and the evidence and showing you what we have as to why we're making the decisions we're making.
Well, and I don't think that they would expect that to become the top priority all
Sure.
of a sudden. They just feel like they're no priority and they'd like to move up that list a little
Yeah.
bit.
Well, I will say to you, give us a lot of money, and we'll move that thing up. We'll move that up as fast as we can. Okay.
You want that on my wallet, you want me to write you a check?
There you go. As the county continues to support our building projects, it will go up. It will not go down the list. It'll go up. And as it goes up, we're going to have to continue to reassess the population, the growth, and talk with all of you to say, hey, here's where we're at. What do you think? It's a collaborative approach. It's never one person making that decision. And Phil can speak to this, and the board can speak to this. I hound people on data. Show me the evidence. If you're going to do something, show me the evidence. Mrs. Lindsay can vouch for that because I've had a good relationship with her the last couple of years. I heard when she was on the board. We are data-driven on these decisions.
Well, I just want to repeat, that's the best answer I've been given, and I appreciate it.
I'm surrounded by excellence, Mr. Pittman, so it makes my job easy.
Any other questions, comments? All right. Thank you all for being here. Thank you to the board members that came as well. Appreciate you coming and giving a presentation. We will see you again for a more in-depth.
Yes, sir, and I thank all the commissioners in the community for allowing us this opportunity to speak to you. One of my favorite things to do is to brag on the system, so any chance you want me out here, I'll come out anytime to talk about our school system, because it is outstanding, and I thank my Board of Education for their support and all the community for their support, because that's what makes this ship keep going forward, so thank you.
All right, we're going to take a break for probably, I'd say about 20 minutes, maybe 25, and then we'll come back